So, good afternoon, everybody. We are yet again at a very successful HITCon 2022. RIMS has been very fortunate to have been associated with HITCon since the start of its inception. And I'm really obliged to and congratulate Management-Hitcon and the whole team who are here for yet another successful HITCon. So I'm Dr. DHRUVI HANSNANI. I have Dr. VIPUL CHAVDA with me. Both of us are going to be sharing, this presentation and talking to you a little bit about a very burning issue about diabetes and how, when we talk about technology, how we can integrate it into our practice as, healthcare professionals. Diabetes is not just managed by diabetologists. It is managed by all the healthcare professionals, be it a general practitioner, a family physician, all the super specialists, everybody. So here I start by, just a small anecdote that if, somebody asks us a question that, what do you think is the purpose of your life? Somebody, would just jokingly say that the server is down, so I can't Google it up. Maybe once when the server is up, we can all talk about it. So this is a very usual phenomenon now that a teenager or even a young adult, and even all of us in our early 30s, early 40s, we feel that we are, using portable devices, but most of the time we are plugged in. This is a usual scenario. Whenever we have a small party, a small get-together, everybody is using their phones or their devices. This is an adult get-together. We meet over for coffee, and after 5 minutes, all of us are in our phones. So let me come back to science now. Why are we talking about integrating technology with diabetes? And that is because one of the most prevalent non-communicable disease, which is responsible for a lot of mortality as well as morbidity, is diabetes. And the global burden is in such million numbers that we are condemned to include a symposium of diabetes in any sort of conference. This is a very staggering figure that we should understand, that when we talk about India, 1 in 18 adults have diabetes. So if in this room we talk by a raise of hands, can you just tell me if one of your relatives is having diabetes, just with a raise of hands? Awesome. So this is why it is very important for all of us to understand that how can we use technology for the benefit of all our patients. So in 1992, we were still using these phones. And it is now 2023 where we are now having a phone called nothing, a phone which is transparent, and something which is very constant is only change. And with that, I'm going to request Dr. Chavda sir to take over the presentation further.
Yeah. Thank you, Dr. DHRUVI, and thank you, the organizers, for providing us the opportunity. I must say that India's strength is diversity, and the same thing is its weakness. We have witnessed that anybody in this room is using more than a technology, but there is something new that we learn from here. And like that, many of patients do not have their access to the technology, and how we can educate them to learn and to combat against a disease like diabetes. That's why we have to use integrated personalized diabetic management. Now, prescribing medicine is not sufficient. We must do an holistic approach in terms of a diet, exercise. Mental health is very important. And for that, we should do a structured education, structured and therapy, adapted SMBG for the patient, structured documentation. And by that, we should do data analysis, and we should provide a personalized care to all our patients who are suffering from not only diabetes, but all the NCDs. Again, there is a AI-based system that helps us to treat the disease like diabetes, in which we have to do a patient-centered health data. And we educate the patient, we take the feedback from the patient, and this circle will give us the proper management plan for individualized patient. In this picture, we can also see the journey of diabetes treatment. In 1920, the insulin was first discovered, and we have just celebrated a centurion years of insulin invention, and we can see that there are so many devices we have developed over the century, but still we are not providing enough technology to our patients. Now, talking about digital therapeutic options, there are many applications which are available. We can use a precision medicine, electronic health record, big data, which can use for making our AI system, decision support algorithm. Hospital at home are also available within our city, and telehealth and wearable sensors are something we all are aware. These are some devices which help us to manage our day-to-day with diabetes or hypertension. There are smart blood pressure monitors, smart blood sugar monitor. There are artificial pancreas is also available that we will discuss in the later part of the presentation. And being diabetologist, I must talk something about tele-diabetology, in which we can provide individualized therapy to all our patient, easily accessible, and wherever patient is, so they can provide data to their healthcare provider and they can change the therapeutic option for that. And because of this D-Connect program, which we adapted our RIMS, we win an award from Diabetes India, that our consultant connect with so many family physicians, and each family physician is providing treatment to more than 50 patients daily. So 2 consultants and they are guiding tens family physician and thereby providing hundreds of patients within a day with standard of care. And talking about the medical application or data record, we have our own Swasthya Setu app, and we all are aware about their advantages as well as features. If you search on mobile application, there are more than 5 million persons using the applications. More than 84,000 apps are there once you type a healthcare application in your mobile. And talking about point of care technology, first we have to do a visit to our clinician. They provide some battery of investigation, then we go to lab, and then we on the other day receiving the reports. But now with the help of POCT devices, we can have SMBG, we can have HbA1c, we can have urine ketone, urine glucose, urine microalbumin, all reports within 5 minutes within the clinic. And this all technology empowers clinician to guide patient in a smaller window of time. With that, I would say Dr. Dhruvi to focus more on diabetic glucose monitoring and insulin pump.
So all of us, the basic technology that we are seeing, all of us have somewhere, somehow used all of this technology for care of our person with diabetes. We no more call them diabetic people, we call them person with diabetes. So we know there is an EHR, that's what sir was talking about, a POCT, point of care therapeutics. That is something very, very upcoming, which gives you the results say, within minutes instead of waiting for half a day or for a full day. So that brings us to a glucose monitoring system. All of us know that glucose, the glucometer is one of them. In the olden days, I am sure there are, very senior people also amongst us who must have used these olden sticks. But now, in this era, we have these very, very small devices that you can just plug into your phones. There is an application in your phone, and just like a glucometer, you just have to put a strip. The number is generated on your phone. It keeps a track of all the SMBGs or the blood glucose monitoring that you've done, and also sends messages to your doctor as well as to the relative that you have preset into. So that is something very, very cool. After all of these, if you can see the monitoring devices, there are so many different kinds. The technology has been increasing in like leaps and bounds. But now we are into an era where you can wear the monitoring device. There is a wearable sensor, a non-invasive technology, which does continuous glucose monitoring. So there are sensors which you can wear for 14 days, there are sensors which you can wear for 7 days, there are sensors which you can wear for 5 days. There are real-time as well as retrospective CGMs that you can use to take care of the blood sugar readings of your person with diabetes, be it your family member or your patient. So time and range is a newer modality. After the advent of sensors, it was very easy for us to track and also predict. You're not just tracking the sugar readings, you're also tracking and predicting that that same kind of a pattern of glucose or glycemic variability can be predicted for the next 2 to 3 months. And time in range is a newer modality which is used as an adjunct to HbA1c for managing your person with diabetes. This is a simple example of what an CGMS profile looks like. It has, average estimated HbA1c. It will also give you daily graphs, and it will also have an arrow to tell you, whether the predictability is upwards or downwards. Say, for example, you have a 90 blood sugar, and you do not know whether to correct it or not. But these sensors tell you if the arrow is going down, you may as well correct it. If the arrow is going up, which means in the next 15 to 20 minutes your sugars is going to rise, you need not correct it. So this is how it is very helpful to to a type 1 diabetic or even a type 2 diabetic, a geriatric, pediatric, or any age of person with diabetes, these sensors are very helpful in our management. So that brings us to a very, very interesting part, in insulin pump. All of us have always had in our mind that insulin pump is a very costly thing. And it has a very bulky apparatus and it has a wire. But these days, there are wireless insulin pumps. They are not yet in India, of course. India has still these CGM insulin pumps. They are sensor augmented, smart guards. And still the size has decreased so much. They are still like a small pager. But the wiring has improved a lot, and it is a auto stop and auto on pump, which means if you have a set limit, say for example, for myself, I have set a limit of say 80 to 140. So the moment my sugar drops to 79, my pump will shut off. And the moment my sugars go to 141, my pump will give me say 0.001 unit of insulin, which is not possible with a regular pen or a regular injectable syringe. So these technologies have been very useful for special diabetes like type 1, pediatric diabetes, brittle diabetes, geriatric population wherein very, very small doses of insulin can be required, and this gives us a very nice time in range, as in my sugars will always stay between 80 to 140 without the trouble of hypoglycemia. So you don't have to be scared. Imagine a child who is sleeping, his parents or her parents are always under the stress कि रात्रि मेरा छोकरा नो sugar down जैसे तो. This pump stops that. This pump helps in the anxiety of the parents. So this is now available in India, and the cost again is a little high, but it is worth it because it is stopping the complications that will happen because of diabetes, and that cost is reduced against the cost of the pump and the consumables that you're doing. There is another thing. A father of a child with type 1 diabetes, he was a biotech engineer, and he said, why not develop some technology, and he almost hacked into the system. Before it used to be that you have to have the same pump and the same company's sensor. Now you can use any company pump and any company sensor, and you can connect it with the use of an algorithm, and there is a DIY, do it yourself looping system. That algorithm will help you to develop what sort of doses you require. You just have to put in the information, of course, using the sensor, the pump, and an algorithm which you develop on your own, knowing your own physical activities, knowing your own kind of food habits. You can store into that algorithm, and that algorithm will make the pump and the sensor work for your better quality of life. So what is technology for? Why are we doing a whole conference on technology? For a better quality of life. We know that technology has its cons, but technology also has its pros. And why not use the pros more when we can? So, that is why we are talking about all of this. There are also pens that track your insulin dosage. Like, I don't remember where my phone is. I know it is lying back, but I might forget it. We always forget our keys somewhere. So imagine a person taking insulin 4-5 times a day might forget an insulin shot once in a while. But these pens keep a track of when was your last dose taken and how much it was taken, and it will really be one very helpful modality.
Only 2 minutes left.
Absolutely, 2 slides. So this is an example of a digital data capture of a person using technology in his or her day-to-day life. An exercise, kitly exercise, how much of food he or she has eaten, how many footsteps, how many hours he or she has slept. It's a whole new world for a person with diabetes using technology, and in a very good way. Another thing is we are researching on insulin pill. That is another innovation in the field of diabetes and technology. We've already had our first oral GLP-1 analog using a technology called SNAC. SNAC has a very huge full form, and I'm not going to say that. In India, we are soon, next year itself, that is what we were told, we are going to have an inhaled insulin. So imagine not taking the shots. You just, put it into your nose and inhale it. You are reducing the shots of insulin. So that's one of the technology. And the world's only long-term CGMS system has come. You can use this sensor for 90 days. It is an invasive thing. It has undergone all the FDA trials, the PRECISE 1, PRECISE 2. The system is known as Eversense. The diabetologist, with the help of a surgeon, will insert the sensor into your upper arm. There is a transmitter and which is connected to a mobile application. You can run, you can swim, you can bath, and the sensor will work for 90 days altogether. And it's really doing wonders for a person with diabetes who has to constantly check his sugars. So of course there are other non-invasive glucose devices. We've heard of the glucose, the Google Lens, iLens. I'm not sure how much good it is. There are of course Fitbits, bands, who say, the Apple is saying that, we are working on using tears to measure your blood sugar. We are using sweat to measure your blood sugar, but we are yet not sure. We don't have evidence onto how accurate these can be. So with that, would you want to see this?
So, RESI for Future Diabetes Care is a digital data, real-time data, social networking and engaged patient and true continuity of care that connect the patient, clinical data and clinician. I would like to add one thing that we just are aware that Rakesh Jhunjhunwala we lost before few days. He was just 62 years old. We are overusing the medicine, we are underusing the technology. We can use the technology for primordial prevention of diabetes. We are aware that many patients who are obese, who have a father, both parents are diabetic. In them, we can apply the technology, we can use the continuous glucose monitor, we can use the wearable devices, and we can prevent diabetes for happening in this population. We can again use it in a primary prevention. We can also prevent secondary complications in diabetic patients. After develop, we all are family physician, we all are aware that patient ne bagde nahi ત્યાં સુધી આપણી યાદ આવતી નથી. But again, it is a two-directional process. It is our duty to make the patients aware that this kind of technology is available. You are at high risk of such a complication or developing diabetes or developing CVD, and with all that devices, we can predict, we can prevent the load of complication in our country, and that's why we can empower the economical system of our country as well.
So with that, thank you, all of you. There is an Ultra HQ. Non-diabetic people are using the Abbott AGP, an ambulatory glucose profile, to see how their food is, giving them a rise in their blood sugar, how exercise is giving them a rise in their blood sugars, and see if non-diabetics can use it. People with diabetes are definitely going to benefit with technology. So maybe the take-home message is, let's use technology as an adjuvant. Of course, we can use the pros and not look at the cons. This is our institute. We have 2 hospitals, a nursing institute, a research unit, an imaging center, and some digital marketing, a small hub for that. So thank you so much again, Management Medicos, and congratulations. Let's all get up. Orman sir and Banshi sir and all, we've worked on a paper where we are talking about walking more. Kadam, I remember that was a project. So let's get up. And I thoda khankari liye adas savarma, and let's give it a round of applause for Management Medicos and HITCon.
Thank you for the wonderful lecture.
Thank you. We are providing nursing education, general OT assistant, Martini training. We also have an NDEP course running. We also have MSW courses for somebody, wanting to get trained into that. We have
BSc nursing.
BSc nursing also.
ANM, yes.
Thank you. Education is something that is an emphasis for us.
I'm so lucky to visit just yesterday.
Thank you, sir. Thank you.
Thank you, sir.